Hello, this is Dr. Grande. Today's question is, what is reality therapy? Now, reality therapy is a therapeutic modality that was developed by William Glasser. And it's based on a philosophy he also developed called choice theory. So I'm going to use the term reality therapy, but really some of the elements I'm talking about here came from choice theory. So reality therapy is a type of cognitive behavioral therapy. It emphasizes needs, behavior, thinking, taking responsibility, and relationships. So reality therapy is based on a few different needs: survival, freedom, fun, love and belonging, and power. In reality therapy, love and belonging is really the most important need, and power is really expressed more as a negative need. There's a negative connotation of power in reality therapy. In reality therapy, all behavior is chosen, and behavior is the only thing that's in our direct control. So problems occur, mental health symptoms, when people use external control, when they try to meet the need for power, but in a negative way. This leads to frustration and conflict and disconnected relationships. According to reality therapy, disconnected relationships, unsatisfying relationships, are the cause of all long-lasting mental health symptoms. So as you can see, reality therapy is a bit controversial. Other core features of reality therapy include taking responsibility, generating a new perspective, and developing a specific plan to reconnect with other people. There's this idea in reality therapy of 7 deadly habits and 7 caring habits. And these habits involve relationships. These 7 deadly habits in reality therapy are criticizing, blaming, complaining, nagging, threatening, punishing, and bribing or rewarding in order to exert control. The 7 caring habits are supporting, encouraging, listening, accepting, trusting, respecting, and negotiating differences. So according to reality therapy, to the extent that somebody can reduce their deadly habits, they can not criticize, not blame, and increase their caring habits, supporting, encouraging, and so on, they can improve relationships and, in theory, reduce mental health symptoms, reduce the frequency, severity, and duration of symptoms. Another concept in reality therapy is the idea of total behavior. And this comprises doing, thinking, feeling, and physiology. And in reality therapy, feeling and physiology are looked at as difficult to directly control, and doing or acting and thinking are thought of as much easier to control. So in reality therapy, almost all of the activity starts with doing or acting, and then moves to thinking, and feeling and physiology are worked on later on, or they're indirectly affected by the changes to doing and thinking. So in my opinion, what are the pros and cons of reality therapy? Well, I'm going to start with the negatives, the limitations of reality therapy, and then move to the positives. So one of the most controversial elements of reality therapy is the idea of blaming relationships for symptoms. Another element is, in reality therapy, instead of using nouns to describe symptoms, the theory uses verbs. So if someone is depressed, a reality therapist might say they are depressing. So there's this idea that behavior and relationships are causing symptoms. Now, of course, we know a lot of information about what causes mental health symptoms and what causes certain mental health disorders specifically. And there is a biological component, an environmental component to many of them. The idea that we can blame relationships or blame behavior for symptoms and for mental health disorders is quite controversial. I think this is one of the less useful parts of reality therapy. Another element of reality therapy that I think is a limitation, although some might consider it a positive, is it does not focus on the past. In reality therapy, the past is viewed as containing a lot of hurt and pain, and there's little benefit to revisiting it. So the effort is put into the present. It's a here and now type therapy. The present and relationships. There is some looking forward to the future as well, but not to the past. A lot of other therapeutic modalities have the past as an important part because it tells us about what could have led to the development of the disorder and what we may be able to change to prevent the disorder from getting worse or to stop maintaining the disorder. So it's based on insight and learning from childhood experiences in the past in general. Reality therapy doesn't have that component. There's no emphasis on the past, and I view this as a limitation. Another criticism I have of reality therapy, and I consider this a limitation, again, some might consider this a positive, is that it's anti-psychopharmacology. A lot of times mental health clinicians work in concert with prescribers to help reduce mental health symptoms. And if you look at the core of reality therapy, there is no diagnosing, and there is a belief that medication, that prescription medication, is generally harmful. And really the whole establishment of psychiatry and other prescribing professions are criticized by reality therapy. Now, I can appreciate how some medications don't work for certain people and how some medications do. But to criticize all of psychiatry and to disconnect it from counseling and other mental health therapies, I think is a bit reckless. Certainly, there is some value in at least certain situations to prescription medication to treat mental health disorders. Reality therapy is very dismissive and even really antagonistic toward all of psychiatry. Now, as I mentioned, again, I view this as a limitation because as a mental health counselor, I like to work in conjunction with prescribers. Some mental health counselors, some therapists don't like that, so they might view this as a more positive element of reality therapy. So my last criticism of reality therapy is a criticism and a concern I have about all of the cognitive behavioral therapies. And I don't consider it a really key criticism, but it's just something that has been noted, and I think it's fair to point it out. One of the basic ideas behind reality therapy and other cognitive behavioral therapies is that the way we behave and what we think leads to mental health symptoms. Now, certainly in some cases, this is probably true. And certainly there's a contribution of behavior and thinking to the development of mental health symptoms in many cases. But we're finding in research that some mental health disorders seem to cause changes in behavior and thinking. So the causality that we see with cognitive behavioral therapy is not really clear. It could be that mental health disorders cause behavior and thinking, and it could be that behavior and thinking can cause some aspects of mental health disorders, some symptoms. So the causality works both ways. Reality therapy really squarely says that doing and thinking cause mental health symptoms, again, along with relationships. Again, I don't think this is a severe criticism. It's just something to keep in mind when looking at the theory behind cognitive behavioral therapy. So how about the positives of reality therapy? I really like reality therapy as far as how it's used to improve relationships. The 7 deadly habits, the 7 caring habits, and particularly the idea that in marital relationships and committed romances, if one of the individuals can stop criticizing, that can lead to the other individual decreasing the use of criticism. Furthermore, I like the idea that criticism is just something that needs to be generally avoided in marital relationships. So reality therapy shines a spotlight on how people use criticism in relationships, and of course the other deadly habits and how the caring habits can be brought in. I find this theory to be valuable specifically when working with couples, but really family therapy and relationships in general. Another aspect I like about reality therapy is that it's positive and supportive. There is a positive view of the human condition, but just like we see in REBT, Rational Mode Behavior Therapy, there's an odd dichotomy that occurs. Reality therapy looks at the human condition as positive, but looks at one of the basic needs as often being negative, or the way people try to meet that need is negative. So that dichotomy is not really as strong in reality therapy as we see with REBT, but it's there, both a positive view of the human condition and a little bit of a negative view. The last element that I like about reality therapy is that when reality therapists are working with clients, the reality therapists work to develop specific plans. plans that are achievable. So there's a realism, which makes sense. It's named reality therapy after all. But there's a realism to developing treatment plans and working toward goals. There's a high degree of specificity. So the theory has a philosophical and abstract component, but in practice, when using techniques, they can be concrete and specific. And I think particularly for a cognitive behavioral therapy, that's a helpful design. It's helpful to be specific and to come up with suggestions that can actually be achieved. So overall, with reality therapy, it's a controversial therapy. It's focused on relationships and behavior and thinking. I think there are useful components, and certainly there are some components that we need to be careful of. I hope you found this description of reality therapy to be interesting. Thanks for watching.